prefer certain foods or apparel, to converse on particular topics, to be inquisitive or passive, and to engage in most any course of action by having such conduct exemplified. So what does this really all mean? All these theorists' theories. So one such aspect is their effects on behavioral counseling. And this really became pretty popular in 1950, and it's still very popular today. So some of the things that behavior counselors use is positive reinforcement. They really try to do that to get that positive feedback again, with very occasional confrontation in therapy sessions. Gottman found that lasting couples exhibit a ratio of at least 5 positive interactions to every negative 1. So great advice from Gottman, who was a couples counselor, that found that lasting relationships are really much more positive versus negative. So that makes sense. Behavior counselors also use modeling. They also use punishment. So one thing that they do is if somebody has a very negative behavior that they're trying to stop, they will have the person use a rubber band around their wrist and have them snap it every time they feel the need to do that negative behavior. So for example, like if they're trying to cut down on eating, they'll have them snap that rubber band on their wrist to just remind them not to eat. Sometimes they'll actually use electric shock as well. And although that sounds horrible, it's not quite as bad as we think it is. It's not like a huge shock, but just dull shock. And that helps to stop negative behavior. They also use timeout. So kind of like what we use with toddlers. They try to take that negative stimuli out of their environment. And they also use systematic desensitization. So much like Peter and that rabbit. They just bring it closer and closer if they're fearful of something. So maybe like if somebody's fearful of heights, they would have them go up one flight and then another flight and then another, something like that. Behavioral counselors really don't like to diagnose, but they really need to in order for reimbursement. So they use DSM-4 diagnoses. And there's a major influence of Bandura's work. So behaviorists really acknowledge the role of cognitive mediational processes, that behavior is a product of one's active regulation of their self. And the cognitive aspect is behavior therapy is arguably the most influential approach to counseling and psychotherapy today. So to do, there are two discussion questions on Blackboard, which Joel emailed us about, and that is it's entitled a Week 5 Class Presentation Discussion. And this is really in lieu of a breakout activity during a live presentation. So please do take the time, if you can, to answer one or both of those questions if you feel like. And this is in addition to the regular online discussion that we have. So I thank you very much for your time and attention to this presentation, and I will talk to you all soon. Thanks. Bye.